Alrighty. Are we officially live?
It always takes me a second of lag, so.
Okay.
Hi, Richard.
You should be good.
Okay. Great. Good evening. I'm Michelle Rehill. I am the chairperson of the Northborough Library Board of Trustees. I call this meeting to order at 7:02 p.m. And I will now read the usual governor's advisory. This open meeting of the Library Board of Trustees is being conducted remotely pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency and signed into law on March 29th, 2023. All the members of the Board of Library Trustees are allowed and encouraged to participate remotely. The act allows the Library Board of Trustees to meet remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. I will now do a roll call of attendance. Members, when I call your name, please say here, present, acknowledge me, please. Brittany Burns. Oops.
Brittany Burns here.
Mitch Cohen.
Mitch Cohen, hello.
Amanda DeRosa Millette.
Here.
Thank you. Pat Fonts.
Pat Potts here.
Jim Hogan.
Jim Hogan here.
Jocelyn McElhenney.
Jocelyn McElhenney here.
Beth Samus.
Beth Thomas here.
Richard Tucker.
Richard Tucker here.
Michelle Rehill is also here. And with us tonight, we also have Jen Brunel, our library director, and Caitlin Stacy, the assistant library director. Thank you all for joining us tonight. My official opening remarks are that we have filled the vacant seat on the library board, and Amanda DeRosa Millette has joined us. Yay. Thank you so much. We're very happy to have you. And I don't know if you want to say anything or just wait, we'll dive into the meeting and you'll have a chance to chat later. Up to you.
Yeah, we can just dive in. That's fine.
Okie dokie then. So our meetings are pretty informal. We just go through the agenda as it's presented. So the first thing on the agenda is approval of the minutes from January 14th, 2025. Unfortunately, we do not have the minutes because there is an issue with somebody's email. We're trying to work on a way to make sure that we do not lose them again. So we will have the January minutes in February. So we will skip over that. And then we will move right to the FY25 appropriations report. Jen, I think you had a comment about the appropriations.
Yes, I did. I just wanted to point out that there were 3 pay periods in January, so that total is higher than you would normally see than it is in previous months. And we also have a merit raise that goes into effect in January, so that bumped the numbers up even more. So don't panic if you see November was like 24 or December was 24,000 and then January was much higher than that. We just had that extra pay period. Everything else is pretty much tracking as it would typically for us, but I'm happy to answer any questions if you have any.
All right. Seeing no questions, we can move on to the library director's report. Did we have time to read the library director's report? It's always my favorite part.
This does not capture the absolute craziness that was last week at the library. So it is not my intention to send these so late. So with that in mind, like anything that you haven't had a chance to get through, if we need to table it for a month, that's totally fine. If you were in at any point last week, you would have seen any number of people coming in and out with heavy boxes. At one point, there was a boom lift delivered that we weren't quite sure whose it was.
I meant to ask, what was the boom lift for?
So the before the projector can get installed in the meeting room, they needed to put an outlet in up on that wall up high.
Gotcha.
So
Okay.
in order for the electrician to come in, they had to drop that off. So they dropped that off on Friday. The outlet was installed on Monday. So that's all ready to go. And then at one point, the AV equipment was delivered and it didn't fit in the kitchenette because it was on a pallet. So we were trying to figure out where to Tetris everything in. One person showed up like a week ahead of schedule to do work that we weren't quite ready for with the HVAC project. So last week was a whole mess of good things. None of it was anything bad. It was just like every time I sat down, I got right back up out of my chair. Let's see. Are there any questions about anything in my report?
Yeah, Jen, in regard to the paragraph about quashing a subpoena that we received, my question is, we don't have separate counsel from the town, do we?
No, we use KP Law, which is the town council. So basically, if we were served with any kind of court order to produce any information, my first call is going to be to the town administrator. They're going to call KP Law, and basically KP Law is going to advise me from there. There's just very limited, without legal review of the subpoena, there's just very little that I can do on my own. So yeah, it was nice to at least get confirmation that like, just because they give you the court order doesn't mean that you have to like immediately produce that information while they stand and stare at you, right? Like there's not an actual, like it's generally understood that you have some reasonable amount of time to have
No,
that.
I agree with that, and I wholeheartedly agree that you should turn over to council. I was just concerned that, and I'm trying to think of an instance, but I haven't, but there could be a time that the town's position maybe isn't our position on something. And using town council then would be a detriment.
In that instance, the American Library Association does offer, through their Office of Intellectual Freedom, legal counsel for libraries and library trustees. So if
good to hear.
Yeah, so if I was, I mean, I would hope that if the town's position differed from the library's position, it would be an issue that we kind of knew about. If I was reading something and I said, you know what, I'm not sure that I want to make this first call to KP Law, we can call ALA and speak to somebody that's impartial.
Thank you.
No problem.
On that same item, my question from the last meeting wasn't so much about that process, although I do appreciate that you've laid all of that out, that we would review with council and make sure it's legal, was on any opportunity that we might give a patron to say, hey, someone just showed up with a subpoena for, the list of all the books you've borrowed in the last 10 years. Do you want to contest this before we provide it? And I know there are some large corporations that do exactly that, and they specify that they will give people the opportunity unless there's some requirement met. And Richard, I'm sure you know much more about this stuff, the legal requirements, than I do. But I'm aware that sometimes that is done, and to give the patron the opportunity to say, no, this is really private. You've got a subpoena, but I want to challenge it. And we might not be in a position where we want to take on that burden of challenging it, but the patron may want to be. And I would love it if we had the legal opportunity to do that. And maybe this doesn't necessarily rule that out.
I think we'd have to decide. whose records are they at that point? Are they the library's records or the patrons' records?
Mhm.
That
So,
would be an issue that
Hmm.
maybe the courts would have to decide, but, that
yeah.
would answer the question, really.
So one very, very good thing, and I know you just used this as an example, about our ILS, that I'm just using this kind of as a marketing tool, is that we don't track reading history. So
Right.
we can't produce what we don't have.
Right.
Right. So the most invasive thing that we could, other than personally identifying information that's contained in the record, would be current items checked out, which in and of itself, right, we would want. From my conversations about this and trying to answer your question, the best answer that I could get was each situation is different, and our first call should be to KP Law and let
Yeah.
them advise if the person should be notified, which I think I'm comfortable with at this point, but I haven't let go of that question because I like what you're saying. I like the idea of giving somebody an opportunity to challenge it on, because our position is, we might challenge something that's overly broad in scope, not correctly written out, or, there's some legal technicality with it. Their challenge might be completely different.
Yeah.
So I like what you're saying, and I'm still working on it.
Yeah.
I don't have any
Right.
policy updates yet.
Sorry. Yeah. And some of it might be, cost related. Council might say, yeah, we can challenge this. There's grounds to challenge it. It's going to cost you $15,000. And, that might not be a burden that the town would want to entertain. But maybe that individual might. So, I don't need to pursue that anymore here, but I am very curious to, as you continue to unwind that, if you see the opportunity to insert that within the policy, that, you know, unless there's some emergency, justifiable emergency to provide this information,
Right.
that we will give the patron the opportunity to quash the subpoena, in addition to, whatever resources that we would have for that. And they might not, they might not have legal standing to do it. I don't know. That's
Right.
I'm not, I'm not at all the expert on it. I believe in privacy when it comes to library usage. And if the system ever changes in the future where it does track you what you've checked out in the past, and I know some of our third-party services do that, for better or worse. I think I haven't looked at this in a couple of years, but I think in CW Mars you have the option whether you wanted to track prior prior checkouts or not. It's defaulted to off.
You
But I
do for
think,
your account,
yeah,
but we don't have access. So even if you turn that on, we can't see it.
right.
So
Yeah,
they
but
would have
it's
to subpoena.
CW Mars probably, or whoever.
I don't even know if they have it on their end. I don't know
Yeah,
if I'm not sure.
yeah. I mean, it would be in their data. If the patron can get it back, it's somewhere in their data.
Yeah.
Yeah, and we already, I think, go everywhere where we should be with patron privacy, and I appreciate what you're saying. Is we don't have a lot of information we can give people.
Right.
Um,
By design.
Materials on holds, your lists. So if you create a list of some topic, what
Mhm.
happens if we get a subpoena that says show us every patron that has this book on a list?
Mhm.
Like, I hope we never get into a world where anyone considers doing that, but we should be prepared
Yeah.
to deal with that to some extent.
And one of the things that kind of dovetails with this is a lot of that falls under the CW Mars privacy policy,
Yep.
Which I know because I wrote it and we just passed it.
Right.
So it's lengthy and robust, and it covers a lot of that on their end. So anything that contains a broader set of data or a more detailed set of data, we would also call CW Mars and run it by them. That's in their privacy policy, that really before we give anything out of the ILS, we should call them. They have their own counsel. So to Richard's point, it's not just KP Law as our only option. They have their own, they can do a review. So we do have a lot of options, and a lot of people trying to protect the intellectual pursuits of our customers. So I will keep looking at that, and I will keep looking at updates too. There's a lot of developments that are kind of coming down in the library world for privacy. So this one I recommended to the administrative subcommittee that we update at least once a year.
Yeah.
It might be more than that if there's any new developments.
I also want to follow up on the other policy on the analytics question that I had read last time. Jen, I truly appreciate the level of detail that you threw in there. I know only for my benefit. I doubt anyone else cares as much or understands the technical things or
I kind
any
of
of
think
those.
she enjoyed answering that question.
Oh,
though.
good. Good. Yeah, I mean, and I verified exactly what she said. If you go to cwmars.org and use their top level catalog, that is tracked. That's awful. They should not do that. But if you access it from the Northborough Library's webpage, which is substantially the same, the Google tracker is not present. So
And
that,
the tracker is anonymous.
eh,
Well, it's not
would-
pairing user data with their search
Yeah.
terms.
Yeah. Yeah, that's a
I
different.
can have them revisit that
Yeah,
though.
yeah, and I don't need to bore the whole board with that level of intricacy of discussion. I am happy to have that
We can have
one-on-one
that
with
offline.
you, or you can connect me with somebody at CW Mars if you want to. There is one thing in looking at the code, and I got the packet late yesterday. I didn't have that much time to go through things. I verified that there is another Google tracker called reCAPTCHA, which is a tracker that does not store data from form fields, but it is a tracker that is present on that search field, on that search page on our website. reCAPTCHA is that little thing of, solve this weird puzzle to prove you're human. That doesn't need to be on. I don't know if it needs to be anywhere within the searching, but it is there even on the first page when you say search the card catalog.
Okay.
That there might be an opportunity to remove and simplify that. But
Chair the policy subcommittee or privacy policy subcommittee, whatever they call it, for CW Mars. So
okay.
I'm interested in what you're saying, and
Yeah.
I see everyone else's eyes glazing over.
Yes, and I apologize. I wasn't expecting that detail to be in the packet. I appreciate it was there for me, and apologize to everyone else.
That's okay. I wanted it to satisfy the question because I felt like the question was valid.
Yeah, and the answer was appropriately confusing about, yes, if you go to see it, they should not have that there. But
we're not here to talk about CW Mars at this point.
Right. Yes.
We can nerd offline.
Yep. Great.
Yeah.
Great. Thanks, Jen.
Yep. Are there any other questions about my report?
I just wanted to tell you how much I absolutely adore the interactions.
They're so great, aren't they?
Yeah,
it's my favorite part.
Yeah, and also the things you're most excited on working on, I find really interesting. So I really like that.
I'm not a cat person because I am allergic to cats, but I do like the fact that there's going to be a program called Cat-tastic Creations.
I love the creativity in that one.
So anyway, any other comments about the report?
I had a quick question. Well, I had a question about the summary notes from the focus group we did. Is that considered part of the report? Is that up for discussion now, or is that?
We have it on the agenda for new business.
Oh, that's under new business. I'll wait. Oh, okay.
Yep. Yeah, it is further down. I would say it's fair game, just not yet.
Getting ahead of myself.
If there aren't any other questions specifically about the report, we can move on to the new business. Starting with policy updates, we received 4 updated policies. do people feel that they had enough time to look at them and move forward? I know that the admin committee is right on that because you wrote all this stuff, you updated all this. If we want to move on and talk about them, because as a board, we need to approve these, so we will have to have a vote on each of the policies. Unless,
Michelle, just speaking for myself, I had the opportunity to review the first two, but not the latter two.
okay. If people are not comfortable, if you are, even if it's just you, Mitch, and I don't know if Amanda might need a little more time to absorb and sort of process some of this stuff. Maybe we can just do the first two policies tonight and then postpone the other two for the March meeting.
That would be fine. The other two, the volunteer policy has extensive changes and the program development policy is brand new. So I would almost just prefer to give you all a chance to kind of sit with that and just wait till next month. The first two are quick, or should be. I think they're quick. Now that I've said that. Do you want me to jump into the first one?
So sure. Yep.
All right.
I'm ready.
So somewhere in a binder in someone's office, we found a policy for the use of the library phone from 1990. It does make references to a payphone that doesn't exist anymore. So I wanted it off the books, and I couldn't tell if this is one that had already been rescinded a long time ago or what was sort of going on with it. But because we had a record of it, I thought, it's just better to, I was originally just going to take it to you guys to have it completely rescinded. But then we have had occasion, I think, to sort of rewrite this. So instead of just the phone, we've changed it to use of library staff equipment, and that would cover the things that are in our offices, the things that are meant for staff use only, things that we would not want our patrons to use because in doing so, it may interrupt our ability to do business. So our computers, our phones, the printer in the back, the fax machine, our chairs. Yeah, and then we did also feel that it was important to keep in this policy at the discretion of the staff. We can give kiddos a chance to call for a ride home. Since there is no publicly available phone right now, this is not related to policy, but we are sort of trying to look into whether it's even possible for Ring Central to sort of craft a patron use phone that would limit international calls or something like that, but to give people who do need to use the phone the ability to use one in the public, since we don't have public payphones anymore. That conversation will be to follow. Right now, since the phone system is not the libraries, it's the towns, it's kind of out of my hand. I've got David looking into it. So that's just sort of like a footnote to this. But so that's kind of what was driving this change.
Okay. Does anybody have any questions or comments about this policy? The use of library staff equipment?
Well, as I read the policy, if I'm at the research desk, is that what it's called? And I'm talking to who's ever there, and I want them to help me, and I'm giving them as much information, my issue, as I can. And it's something I forgot. I said, "Oh my gosh, it's on my desk, but I don't have my phone." And I called my wife, tell me what it was. You're not going to let them do that, right?
If
Or you're
there's
not
an
going to do
emergency, or if there's an urgent situation where you need to make a quick phone call and you're like, you know what, I left my phone at home, I need to call my wife really quickly and tell her I'm ready for her to come and pick me up, I allow staff to use their discretion. the general
Doesn't say
rule,
that.
Right.
because it's very hard to write that in.
Yeah.
Yeah.
Because define emergency, define quick, define, calls of an urgent nature. I mean, I don't want to go into too many of our recent struggles, but there's a huge difference of opinion in what would constitute need for the use of a phone. But we've had people come up and say, can I use your phone can I use your phone? And we kind of go through it and they're like, well, I need an ambulance. And it's like, okay, leave with that. We will call one for you.
Yeah.
If you needed to call your wife to come and get you and you left your phone at home, we would make an exception to the policy. But I don't want to encode it into the policy because it puts my staff who are at the front line at risk of, if they say no.
Use of discretion, maybe people say you're abusing your discretion. You allowed him, you didn't allow me. Huh? So I understand the issue, but I just think your staff have the last word on whether they're going to make a call for you or not.
I agree with Richard that I am concerned this is just a hair too strict. I appreciate what you're saying. What you're saying, Jen, is kind of what it should be, but it doesn't say that. I think the current senior building administrator, the director or Caitlin or whoever is there should be able to make an exception, at their discretion. And I appreciate somebody's going to say, well, why didn't you let me call for Domino's? And that's, you can push back on that. But yeah, I mean, Richard, you bring up, a perfectly valid thing. And it could be a kid who is there to study but left their textbook at home. Well, the policy says if they need a ride, they don't need a ride, they need a textbook. That says, no, sorry, you can't do that. I don't know. I think leaving the door open just a little bit, understanding that there's some risk for abuse. I'd rather leave that open than closed, from my perspective.
I think the good news, excuse me. I think the good news is that no one is reading the policy except the staff. So if someone comes up and again, as Jen said, staff discretion. If, I really, I need a ride and I don't have my phone. Oh, okay, fine. Great. I need my textbook. Okay. But they're not reading the actual policy. You see what I'm saying? So the policy is there to guide the staff. And within that, I think there is enough wiggle room for the staff to make that judgment.
Not the way it's written right now.
I don't see any wiggle room.
Right.
Yeah.
It only provides that opportunity for underage for a ride.
I wonder if we,
sentence. Oh, go ahead.
I was just gonna say, if we adjust that language to say, at the discretion of library staff, patrons may be permitted to use a designated phone to make urgent calls limited to a maximum of 2 minutes. And that gives staff flexibility in situations. And then you don't have, I mean, I could see what you're saying, Mitch. The problem is if staff violates the policy, another patron can complain about that too.
Yep.
So I think that's where it gets problematic.
Mm-hmm.
The reason we were trying to limit it to minors is, emergencies are emergencies, and no policy is going to stop somebody from, like, if you need 911, you need 911. It is very, very difficult to enforce discretion consistently without additional guidance on what is and isn't. And so without asking questions about, well, why do you need to use the phone and what are you making this phone call for, is exactly what we're trying to clarify with this policy, which is why it is specific, because this is sort of what the staff got together and said, like, this is really the only time that we ever really want somebody to use the phone. With adults, we had been applying our discretion inconsistently, and it led to an issue. Not that you necessarily want to make a rule around one issue, but I would say it was a couple of different times. So trying to give people guidance on who should be using the phone and who shouldn't be using the phone. I don't know if we really should be using a business phone to let somebody call like, hey, I forgot my glasses. Well, maybe you just go back and get them. I don't know. I really think that there should be very limited exceptions to the no phone rule. And that is generally to help kids. So I don't know. We could kick it back to the administrative subcommittee for more discussions, but I don't want to put my staff back in a position where there's a really overly broad, like, because what it says is at your discretion, you can let someone use the phone. So then you have a patron who's saying, well, you could let me use the phone. You're not letting me use the phone. This is your fault, and now I'm personally upset at you. So.
Can I ask a clarifying question?
Yeah.
When somebody asks to use the phone, is the expectation that the staff will place the call or they hand the phone over?
Usually, if it's a teen, we just dial the phone for them and hand them the receiver. So I've walked by desks where we've handed an adult the phone, and what they do is they take the phone and they turn their back on you, and it's 5 minutes, it's 10 minutes. It starts off as like, can you come get me? Oh yeah, on your way here, can you pick up milk? Oh, my day was great. How was your day? It's, I think for the general rule, we just don't want adults using the phone.
Yeah, I think your course of action pursuing a designated patron phone is a good idea, because I think the point of this policy, is it says it impedes your ability to do your work if any of these tools are tied up, right? And yeah, you don't know what somebody's using the phone for or what they're requesting or, all of these kind of pieces. It's not a public phone. It's not a pay phone. But I think a lot of this discussion would be different if there was a designated patron phone. So if that's an option, that kind of eliminates these concerns. So I'm almost disinclined to kind of continue the circular conversation right now until we know if that's a possibility.
Yeah, and I would really like it to be. I think it would be really nice to be. I mean, we offer hotspots, we offer laptops, computers. There's lots of different equipment that we offer. The ability for somebody to make a phone call to an important phone call that they cannot make at home. There are lots of privacy reasons why that might be a good idea. We have referred people over to Health and Human Services to make phone calls before. It would be really nice if we had that ability, for them to do that in a private room in the library, but within reason. So I think for a public phone, the rules would be a little bit different, but since it is a desk phone, we'd really like to limit it.
Really, this is a little bit moot because there's probably at any one time 60 phones in the library on all the patrons. So you can go to the guy next to you. Hey, can I use your phone for a minute? But I'm just saying what it says. I think it's a little strict.
I had two thoughts as following from those conversations. One, maybe if we adopt a policy like this, like proposed, adding into something in addition to what Brittany suggested of, for reasons relating to your purpose for being at the library or reasons relating to library business, so that it would cover, I'm studying and I need my textbook, or I forgot my glasses, but it would not cover, I want to order a pizza or argue with my neighbor. It forces us to ask why, but I think we should ask why. And the other piece is, I think by policy, staff should always dial the phone. Just so that, it is clear that it's an appropriate, whether it be local call or, somebody is less likely to have you call something for something stupid if somebody else is dialing the number.
I think if you said something like, for just cause shown, any staff member who's got possession of a phone may allow a patron to use the phone for a short period of time. And think of if your son or daughter and they didn't take their phone and she or he wants to go sleep over their friend's house and they just got an invitation. And the mom's coming to pick them up, you know?
Do we want to disrupt a business phone so that a kid can ask if they can sleep over at their friend's house, though? You know what I mean? Like, it goes back to like, this is a phone that patrons are calling in on. And if somebody's on that phone, that person can't get through because they're not just routed to another phone. They're directed, they have to hit the extension that they want. So they'll get, this is, surrounded by or concerning the teen desk phone. So they will end up getting Bonnie's voicemail.
Talking about a 2-minute call. Not all day.
Mm.
Yeah.
I think we should be a friendly place. Why don't we want to be a friendly place? Especially to teenagers who are.
I am happy with kids under the age of 18 being able to make those calls and to loosen it up for kids under 18. I'm not right now at this point willing to say that adults should have. I don't know, Caitlin, you got to step in and help me here because I feel like I'm being very inflexible on this one, which is not characteristic
it's
of
okay.
me.
I was sitting here thinking, I was trying to think back through, because I've been on the reference desk quite often. And it's like, as much as I would love to just be like, hey, go ahead, call your friend and, ask whatever. It does tie up that phone. And then you also have somebody there at the desk talking on the phone, and you have a patron that comes up to you, needs assistance. It's really hard to balance that, like tuning out that conversation, and trying to help the person that you're with. So that, can cause kind of like some issues. It's really a workflow thing is kind of where
And then
I'm
the
at
phone
with it.
rings while they're on it and you can't get
Well,
to
and
it.
that's the thing. When the phone rings while they're on it, we can't answer it. And they end up getting sent to voicemail, or, they don't leave one. We can't contact them again. It's just, if we allowed everybody to just use the phone for whatever small, like minor need it might be, then we would not be able to do our jobs effectively. Our staff wouldn't be able to provide the services they need to. Like Jen said, I'd love it if there was a public phone. That'd make it so much easier. It's like you think with, it's like I was around at the end of the payphone era. But it's like in essence they were great because they were right there. You can make the call you needed, easy peasy. There's an assumption that everyone has a phone now, right? So it would be nice like if we could get Ring Central to give something for us. But as of right now, we don't know if that's possible. And I think it's more important to support our staff, and to let them be able to do their jobs effectively. And I trust our staff enough to be able to make the correct call and to, like, if we have to ask questions, ask the right ones. I think they're just looking for a little support on the back end, and just saying, okay, like I have this situation, how do I handle it? Okay, here's a policy I can look at, I can read through and go forward. And so yeah, that's kind of really my thoughts on it.
I think that's
And
really well said, Caitlin. You think you voiced it really eloquently. And just to add, like all those 2-minute calls add up. And anytime somebody sees somebody making a 2-minute call, it makes them think like, oh, I can use that phone too when and
Well, and is it an effective use of staff time for us to sit and monitor somebody that's on the phone for all that time?
Do you have a sense, Jen, when you'll have an answer from IT on whether there is a technical ability to add a public phone?
I would imagine that I would have an update by the next meeting.
Okay.
And I also think that if Ring Central is a no, that there's other options.
Okay.
You know what I mean? I feel like it is something that we want to pursue. So if Ring Central isn't that route. And maybe it shouldn't be the same phone system. Maybe it should just be a separate,
Yeah.
like, landline phone.
Any IP phone
Yeah.
in service for $20 a month can probably do what you want.
Right.
Yeah. I'm going to make a suggestion that maybe we table this for one meeting until we get that answer, because a lot of the discussion that we are having becomes moot if there's a public phone. At that point, you don't need any of this. You could just say nobody can use the phone because there is one available, and that's the end of it. And, or we we open it up just to a tiny degree that, in cases of an urgent situation with the child, library staff will make a phone call on behalf of the child or something like that. Obviously, we're always going to call 911. That's staff's duty to do that. We don't need a policy for that.
Right.
But these gray areas can run us around in circles. And if we find a way to get a public phone, and I think I'm seeing general support of the trustees to support that, certainly from staff to support that, then this whole issue goes away and we can have a very ironclad policy and we don't have to worry about exceptions.
I would sort of counter propose, not too far. One thing is that we need to get rid of the policy for use of the library phone as it's written, because it's problematic. Wasn't there something about payphones in there? I would, in the event that this takes a while, in order to make the library staff feel comfortable in the interim, I would prefer, possibly, I would suggest that we have a motion to rescind the policy for the use of library phones and accept the use of library staff equipment as stated, or as presented. And as a board, because we're swapping out one policy for another policy. This policy is a little bit broader than the policy for the use of library phone. It helps the staff in terms of all of those other things, not just phones. We're focusing on phones, but it covers a lot of other stuff. If we discover that there is some issue related to, Jen cannot manage to come up with an alternate a patron phone, then we should know within a month or two whether that sort of thing can happen. If we really feel that this policy is problematic, we can refer it back to the committee to revisit and work on the wording. But I think in the meantime, I feel as if we need something that's in place for the benefit of the staff and not leave them hanging with a policy that makes them uncomfortable right now, or have no policy at the moment.
My caution with that is I think many of us are concerned with this policy as it is written, in that once we get an answer on public phone or no public phone, we would probably have to revisit it. At least I would want to. I am comfortable making the motion you suggested, maybe adding a qualifier to the end of the adopting a new policy that it expires after 90 days to give us the opportunity to get that answered, figure it out, bring it back again, forces us to bring it back again, knowing the answer to the public phone situation, which will drive us one way or the other in the discussion.
So I don't know if this will make it easier. It just occurred to me that it's entirely possible to use a laptop with a service to make a phone call, and we have laptops. So by the next meeting, if Ring Central isn't, and I don't even know if I want Ring Central to necessarily be the service that we're using for patrons to make phone calls. But it looks like there's so many different options for us to just be able to set somebody up and let them use a laptop to make a phone call. So I can just commit to providing at the next meeting some kind of policy for a public phone. You know, I think we can figure it out by the next meeting. So it looks like one way or the other, we'll be able to let the public use something to make a phone call, is I think what I'm.
Yeah, I mean, the danger of using a laptop for it is then that takes up staff time to set that up for the person.
Well, but we have them.
Yeah.
So.
Yeah. Yeah, then do we need this policy? Do we need the permissions part of this policy at all? If we can provide a phone, then I don't think we need any discretion at all. I think it's perfectly acceptable to say, no, public can't use our phones.
I'm fine with striking the last two sentences.
All right. So at the discretion of library staff.
Yep.
Patrons under the age of 18. And then calls will be limited. So strike those two sentences.
It would not prohibit staff from making a decision that says, you know, hey, I, the staff person, I'm going to call this person's parent. That you always have that ability if it's a, I don't know, a 6-year-old kid that needs to call for a ride because their parents aren't there, which would never happen, of course, but maybe it does.
They can't be there if they're sick.
Yeah. Yeah, there are, those situations are fine. And if somebody is a teen and they are there, they'll know how to use probably an IP phone setup better than anybody. Yeah, I'm good with that.
All right. Somebody's going to have to make a motion.
I talk the most, I'll make the motion. I move that we rescind the policy titled Policy for Use of Library Phone, and further that we implement or approve new policy, Use of Library Staff Equipment, as presented, deleting at the discretion of library staff, patrons under the age of 18 may be permitted to use a designated phone at the teen desk to make calls for rides home. For a ride home, calls will be limited to a maximum of 2 minutes, but otherwise as presented.
I second.
So wait, hang on. So Mitch, you moved that you made the motion. Thank you. And was it Pat? Was that you?
Yes.
Seconded. Pat seconded. Thank you.
But this is on the idea that we're going to revisit this issue again, right?
Yeah.
This is also you trusting my word that by the next meeting, I'll have an alternative for patrons.
Okay. All right.
I'm committing to that right now.
Okay.
Delegating that to Caitlin.
Okay, now, just a minute. Just a minute.
Jim, yes.
So Mitch, you're gonna have to send me in writing your motion.
Okay. I'll start a blank email now so I don't forget.
Thank you.
Thanks. All right. So we have to do this because it is a motion on a policy. All those in favor of the motion as presented by Mitch, please say aye. Brittany Burns.
Brittany Burns, aye.
Mitch Cohen.
Mitch Cohen, aye.
Amanda DeRosa Millette.
Amanda DeRosa Millette, aye.
Pat Fonts.
Pat Fonts, aye.
Jim Hogan.
Jim Hogan, aye.
Jocelyn McElhenney.
Jocelyn McElhenney, aye.
Beth Samus.
Beth Samus, aye.
Richard Tucker.
Richard Tucker, aye.
And I, Michelle Rehill, also vote in favor. The motion carries in the affirmative, and it is unanimous.
Thank you very much. Made myself a note, so you will see a public phone very soon. The next one was the patron behavior policy. Is that correct?
Yes.
All right, I'm going to go line by line and then just sort of pause. So if you have any comments about that change, we can kind of address them as we go.
I have actually one question that's not a change, but it's at the beginning.
Yeah, go ahead.
The following activities are allowed in the library: filming library staff and patrons.
Mhm.
I think that's reversed.
You
Except,
are allowed to film in the library.
okay.
That's the First
Yeah.
Amendment audits.
Oh, yeah, I don't like
have
it, but yeah, you're right.
over and
Okay.
over again. You can film kids. You can film staff. You can film whoever
Don't
you
go
want.
into it. We'll be here all night.
Yeah, you're right. Yeah, I was thinking in the reverse when I read it, but yeah, all right. Comment withdrawn.
All right. So the first one is the first two really are just language changes to make it align with activities. The way that it was worded before, they weren't activities, so we just fixed the verbiage on that. So the first sort of real substantive change is it currently says misuse of restrooms, such as using the library as a laundry or washing facility. We had a resident raise a concern that might have, the way that it was worded might have been specifically targeting a group of people. So I did take a deep dive into whether that was accurate, and what the case law was on that and what other library policies said. And I'm confident that it's fine to prohibit use of the library bathrooms as a laundry facility or to take a shower or something like that. But I think the red wording is just better. It just is more clarifying to what it is that we're trying to prevent, and why. So no, we're not specifically taking aim at somebody that's trying to wash something off of their shirt. We're trying to address the safety hazard, or preventing use of the facilities by others. So I think the language just sort of expands on what that rule is so that it makes a little bit more sense in context. Any questions on that one? Okay. If you skip down, it currently says entering the library with body odor or fragrance that hinders use of the library by other patrons. This was another one that was raised as a concern. And I think there's a lot of merit to that. Because the way that it's written, body odor, we're not talking about natural body odor, but the way that it's written, that's what it sounds like. So what we're actually talking about is not the way that somebody's natural body smells. It's an odor that poses a possible health risk. So I think I went deep down into this one and I found where another library had a legal review of this, and this was the suggested language. It's much more specific to why we would want somebody to mitigate an odor. So for example, if you spill gasoline all over your coat and you come into the library and your coat smells like gasoline, it might be making other people sick. People might be worried that there's some kind of hazard. It might be flammable. Asking somebody to just take their jacket off and leave it outside. Something like if you're walking through the park and you step in somebody else's dog droppings, and you don't realize it, and you come into the library and somebody can smell that. That's something that you might just need to go in and clean off your shoe before you come back in. So this is a much more comfortable wording for me. It sort of explains what it is that we're looking at. It's not just like, oh, your perfume smells bad to somebody, or your food, or maybe you came from the gym or something like that. Like, those are not the things that we care about. We care about something that might harm somebody else. Any questions about that one?
Yeah, I do. Sorry to be picky tonight, but you say it poses a possible health risk, and you have a parenthetical to explain that, and you say hazardous chemical, people, rotting food, smoke, communicable infection. I think that should be the end of the parentheses and then say, or any substance that can damage the library. Because that, something that can damage the floor or something isn't necessarily a possible health risk. Or pose a risk. I just think the
Yeah, I see what you're
parentheses
saying.
should end there.
Yep, so the parentheses should end after the word infection.
Yes,
You are correct. Thank you.
you're welcome.
I have the same concern. Appreciate it, Richard. Thank you for being picky tonight.
No, I appreciate it. We should not all just stare at each other in the Hollywood squares and say nothing. It makes the meetings boring. Anything else on that one? Okay. Again, we just adjusted the wording so that it kind of made sense.
Ooh, Jen, 1 second.
Yes.
Before we move on, now that Richard has made his edit, I feel we might need another edit in that
Okay.
previous line.
Yep.
So moving the parenthetical to after infection or any substance, now the mitigation should be against the odor or the substance. So patrons must address any odor or substance. And if a risk is determined to be present, mitigate it immediately. You know, again, it is strictly a grammatical
Yes.
update. It doesn't,
Yeah,
I don't think it changes the context of what we're saying, but it brings those sentences into agreement with each other.
It's better to do it now than in 3 months and come back and say we have another grammatical error.
Thank you, Richard.
Thanks for correcting me.
The one of 2 down, bringing animals other than service animals in training or animals supporting a library program into the library. We talked about this at our subcommittee meeting and realized that there are really no circumstances other than those in which I would write a permission for somebody to bring their animal in. So we're striking that last part of that line. Any questions about that? There's just no way there's no reason to have it in there.
It was a fun discussion, though.
It's true. Let's see. Soliciting donations, that line is being struck because we have a policy on that exact thing. So it just doesn't need to be in the patron behavior policy. Also, this language conflicts with that language. So this goes away. That is it for that one.
I have a question in the last paragraph. The third sentence, it says serious or repeated failures to comply with this policy may be denied access.
Yeah.
I don't think that you can deny access to a failure.
See, we didn't catch it the first time we went through it.
We were so concerned with the parentheticals, we missed that one.
And actually, when was the last time? We updated this one recently too, and we missed it then too.
Mm-hmm.
So
This has to be rewritten.
we're all on our game tonight.
Do we want to take I feel like the motion to accept this one would get very messy. Do we want to take this back and fix it?
probably wouldn't hurt, just so we can for purposes
Before
of
putting it before,
clarification.
So the typo
I don't
that
want to make
Michelle-
Jim's head explode.
The typo that Michelle just found is in the current policy as the one that's already approved. So we can either fix it tonight, or if you're comfortable, approve the other changes that were presented. This last paragraph, I'm not ready to present changes on it yet because it's undergoing legal review, but we need to address that last paragraph in its entirety. It is not specific enough. But I don't have the verbiage ready for you because I do need that to go through legal counsel because that relates to denial of access to the public library, and I don't want to get that wrong. So if Michelle is okay with,
I was going to say, unless you really feel that you need to have this part of the policy in place, if we're going to have to, we know we have to go and revisit it after you get the legal advice. Can we just send it back to committee for correction and change the verbiage once you get the legal advice, once you hear from legal, and get that part in there as well?
yes,
Okay. So we're going to send patron behavior policy back to you to have it come so that the subcommittee can review it, make the changes necessary. And then once you hear from legal, get those changes in there.
can I just ask you to approve striking the soliciting donations part because that conflicts with our other policy. So that's the only critical one.
I mean, I think we could just vote to accept these changes and then look at it again when we're going to adjust that second paragraph. If all we're really doing is grammatical changes to what's here, I don't know.
Mm-hmm.
Like the model UN in me wants to accept friendly amendments without having to specify them, but
Yeah.
I don't think model UN rules apply.
I think if the amendments are typographical in nature, which I think everything we've talked about is, it can just be as referenced in the discussion.
Mm-hmm.
Or something crafted like that.
And with the, oh yeah, because I was saying then that would strike that, sent that bit that Jen really wants out.
Yeah.
So
because we're moving a closed parentheses and adding something about materials, and
the word substances.
substances. Yeah.
But then all of the content changes we need, Jen, are passed, and we can revisit that last paragraph when you have the legal language.
Okay. Which brave soul wants to make that motion?
I'll give it a shot.
All right, Jocelyn.
I move that the board accept the patron behavior policy as presented with the typographical changes as referenced in the discussion.
Second.
All right, that means I did it right. Thanks, Mitch.
Thank you, Jocelyn, for doing that.
So Jocelyn moved, Mitch seconded. Again, we need to have a vote on this.
Again, Jocelyn, you'll send me the text.
Sure. Let me start that email.
Start the email so you don't forget.
Thanks.
All right. All those in favor of accepting the motion as presented regarding the patron behavior policy, please say aye. Brittany Burns.
Brittany Burns, aye.
Mitch Cohen.
Mitch Cohen, aye.
Amanda DeRosa Millette.
Amanda DeRosa Millette, aye.
Pat Fonts.
Pat Fonts, aye.
Jim Hogan.
Jim Hogan, aye.
Jocelyn McElhenney.
Jocelyn McElhenney, aye.
Beth Samus.
Beth Samus, aye.
Richard Tucker.
Richard Tucker, aye.
And Michelle Rehill also says aye. The motion carries in the affirmative and it is unanimous. So, and we have agreed to we have agreed to go over, move off the discussion of the volunteer policy and the program development policy. And we will we will do those in March. So we can move on to, under new business, the health and wellness consultant report.
Yes, and just real quick before I go on to that, for the library program policy, please feel free to try to break it because it is a new policy. It's modeled after a collection development policy, but because it relates to how we choose programs, how we choose speakers, how you can challenge or not challenge things, and sort of the theory that goes behind a library program, because we don't have anything, please try to break it. And if you find a way to break it, send me an email so that I can compile all the feedback, and we can really make it good.
Okay.
All right.
Alrighty. Making a note to myself, sorry. The notes from the health and wellness consultant report. Does anybody have any questions or comments that they would like to make about that?
I do. Now that it's the appropriate time of the meeting.
That's right. I knew there was something like
Under the trustee discussion section, the very first, I just, for my own clarification, because this meeting was a while ago, the first line, the trustees envision the Northborough Free Library as the community's go-to resource for health and wellness information. Is that what we said? Because I feel like the way that reads is like, I still would prefer people go to doctors, you know, like I don't know who these notes are for or what the like next kind of step is, but that line just kind of was concerning to me, is like, I don't want us to replace healthcare systems or become people's first line of, you know, search for information that broadly. You know, I think there's certain things we had talked about, but yeah, that just kind of jumped out at me as like, I don't think that's what we said, but if I'm misremembering also, I'm just one person, so.
Can you point me to that line?
Yeah, so it's in the trustee discussion section, the very first.
Page 3?
Oh yeah, page numbers would be helpful. Yes, page 3, sorry. That was below my screen. I didn't see the page. So yes, page 3.
I don't believe that's exactly the way that I see what she means, but I don't think it completely reflects what you were, like, to your point, Health and Human Services, your doctor, multiple other things.
Yeah.
So I'd like to ask her to reword that, and I think what I'll do is I'll go back to the tape and see if I can find something that better reflects the nature of that discussion. Because I don't think any of you would want us to be the first step. We're like, what is this rash?
Yeah,
I think the intent,
what is that?
I think the intent is that we're seen as a trusted resource for valid information, but not a clinic.
Yeah.
Right.
Yeah, I think the way everything is enumerated afterwards, it, you know, called out, you know, sending people to professional, you know, accurate sources of information as opposed to being the health professionals. And I think we wanted to be the go-to spot for online information, for published information, not diagnostics.
I mean, one of multiple first points of contact on health and wellness information that, you know, obviously your staff is not going to be providing health information, but they'll be directing people to where to get the right answers. But for many people, the library is the first step of gaining information about a wide range of topics, including health and wellness.
I mean, and they do say in that sentence at the end, it's like the go-to for information, not, but yeah.
It's still just, information could be, what's this rash? Do you know what my rash is? That's also information seeking, you know, and Yeah, I don't think the professional, personalized, and confidential actually does a lot to help clarify what we mean. Because it's like, oh, will you have a professional nurse available? Like, what kind of professional person? Is it the librarians? Like, I know it's library staff, but that's also, a little point of clarification. I'm not saying we don't want people to come to us for information. I just want to set expectations of what that is.
You're right.
Yeah.
I think asking about your rash also flies in the face of the behavior policy we just adopted.
I think you're right.
Point of order. I think we covered it in the previous policy.
Only if it has an odor, Jocelyn.
Nice.
Or
Nice.
substance.
No,
Or substance.
we're done. You know what? I am so sorry I spoke up.
Okie dokie. Were there any other questions that anyone had? Because I think if Jen can compose herself, you might
I'm just
have
having flashbacks to my college subway days. Thanks, Jocelyn.
Dude, I quit. I'm sorry. I should just go.
I am
No,
having
it's fine.
flashbacks to the inner city library that I worked in a number of years ago, where the answer to a lot of reference questions was a doctor.
Oh. Amanda, I am so sorry that this is your first meeting. I'm so sorry.
No, this is good. I'm a member of the Historic District Commission too, and our meetings are not this fun. So this
Do you
is
want
good,
me to join
Jocelyn.
the
I'm good.
commission? Because I can bring this energy over there. I promise.
Great, that'd be great.
Yeah. No, I apologize. I also had a visceral reaction to that sentence from my reference days. Like that was straight from my experience on the reference desk that I said, oh, please, let's clarify what we mean.
Oh, gosh.
I knew exactly where you were coming from, Beth, when you said don't send more people to us seeking medical feedback.
Yeah.
No copays at the library. Woohoo.
Oh,
but they can't call a doctor from the library, so we have
wow.
that too.
Just 911. We said that one's okay.
911.
Jill, are you entertaining a motion to just end the meeting? Are we there yet? Because I think we've lost control.
We're so close.
If we go past 8, this is what happens.
Jen, didn't you mention something whilst we were waiting about maybe somebody was going to be around in April? And
yes, Maura has graciously offered if you would like to meet as a board in person in April for a meeting. She is close to a draft plan for us, and she will actually be in the area that week. So she's offered to come and present this in person, and we would have the new AV system by then. So you can, come and ooh and ah over the stuff and actually meet Maura, because the meeting will be correctly posted. And and she'd also like, because it's the first draft, she'd like to get everybody's feedback and start to, talk to key stakeholders. Did we hear you correctly? Is there anything that is missing or anything that we didn't necessarily fully understand that should be incorporated? So that offer is on the table. That would be, I think, April 8th.
April 8th.
And that's good because we may or may not have the legal ability to meet remotely after the
Oh, I know.
I
saw
anyway. Yeah. Everyone seems to think it will get extended, but no one has agreed how or when.
Right. Last time they just they just kicked it down the road, right?
Yeah,
and then
they kicked it down the road to next month.
Yeah.
And they waited a couple of days too long, so we did have a couple of meetings that had to be in person and a couple that the postings needed to be changed at the last second. I'm doing what little I can do from our town's perspective to influence our legislators to at least give us time. We'll see.
So anyway, all right. So if we have nothing else to discuss on the health and wellness consultant report, I'm seeing nothing.
Did we decide that she's going to meet with us?
She's going to be here, so yeah.
Okay.
Good.
Tomorrow we'll meet with us. I just wanted Jen to tell you that because she had mentioned that to me in passing earlier. whilst we
I
were
thought it
waiting.
was a question as to whether we wanted to do it or not.
Oh,
Okay.
no, sorry, Jim, you're gonna have to have an in-person meeting in April and Maura's gonna be there, so. I didn't mean to give you the impression that you had a choice. Sorry, that was me. I was misleading, I guess. All right, our next actual meeting will be, I'm assuming, yes, it can still be remote next month, Mitch?
Correct.
Okay, our next meeting is on March 11th at 7 p.m. It will be remote, or online, or whatever you want to call it. Is there someone, Jocelyn, who would like to make a motion to adjourn the meeting?
I move we adjourn this meeting. Do I have to send that to you, Jim?
I will second it.
No, I've got that one.
Okay.
Beth, did you second
Yes,
that, Beth?
that was me.
Thank you. All right, I will do the roll call. All those in favor of adjourning the meeting, Brittany,
Brittany Burns, aye.
Mitch,
Mitch Cohen, aye.
Amanda,
Amanda DeRozier Millette, aye.
Pat,
Pat Ponce, aye.
Jim,
Jim Hogan, aye.
Jocelyn,
Jocelyn McKelney, aye.
Beth,
Beth Thomas, aye.
Richard,
Richard Tucker, aye.
and I, Michelle Rehill, also vote to adjourn the meeting at 8:18 p.m. And thank you all for being here, for your patience and everything else. And see you next month.
So
Good night.
Night,
Bye, guys.
everybody.
Night,
Night,
everybody.
everybody.